So today I'm going to talk a little bit about ion balances with six key ions. The first one is sodium. It is the primary cation of the extracellular fluid. Its importance is that it keeps the fluids in a normal balance, and then it plays a key role in nerve and muscle function. Normal ranges are 135 to 145. What can happen when you have an excess of sodium or hypernatremia is intracellular dehydration. You can experience convulsions, have some pulmonary edema, hypotension, and tachycardia. This can be caused from an excessive loss of water from the urinary tract or excessive sweating. If you have too much of a diuretic, it can cause this. And if you have too low of sodium or hyponatremia, it can cause dizziness, fatigue, lethargy, malaise, thirst, headache, or confusion. You see this in patients who, again, have diuretic use. This can be because they're not having enough diuretic, so they're retaining that water and diluting the sodium. Diarrhea, heart failure, liver disease, and renal disease. Really anything that can cause that water retention is gonna cause a low sodium level. Now on to chloride. Chloride, it goes hand in hand with sodium, so wherever sodium goes, chloride will follow. So like with hyperchloremia, you'll see that with hypernatremia, but chloride helps maintain proper blood volume and blood pressure and a normal pH. It is ECF anion, and it provides electroneutrality. The normal ranges are 96 to 106. Hyperchloremia is an excess of chloride, and like I said before, it can occur with hypernatremia or with a bicarbonate deficit. Some causes of it can be hyperchloremic metabolic acidosis. When you have hyperchloremia, you can experience some intracellular dehydration, convulsions, pulmonary edema, hypotension, and tachycardia. On the other side, hypochloremia, when you have too little of that chloride, it's because of a loss of bloody fluid from prolonged vomiting, diarrhea, sweating, or high fever. It can, some of the signs and symptoms are fluid retention, high blood pressure, muscle weakness, spasms, twitches, or confusions, and irregular heart rate. Now on to potassium. Potassium is a major intracellular cation. The concentration of this is maintained by the sodium potassium pump, and it's essential for transmission and conduction of nerve impulses. It helps keep a normal cardiac rhythms, and it helps with skeletal and smooth muscle contractions. The normal ranges for potassium is 3.5 to 5. The change in pH can affect potassium balances. With hyperkalemia, you're going to see some tiredness or weakness, numbness or tingling, nausea, vomiting. Some people might complain of chest pain or having trouble breathing, You'll see the palpitations or irregular heartbeats. It can be caused by just an increased intake of potassium. Like for some of those who are taking diuretics, they'll prescribe a potassium supplement because sometimes they're not prescribed a potassium sparing diuretic, and you could get too much of that potassium intake, causing the hyperkalemia. It can be caused from a shift of potassium from the intracellular fluid. Decreased renal excretion, insulin deficiency, or cell trauma can cause these high potassium levels. On the other hand, with hypokalemia, it can be caused by a reduced intake of the potassium, increased entry of potassium, or increased loss of potassium. With this, you'll see a decrease in the neuromuscular excitability, skeletal muscle weakness, and smooth muscle atony. Aldosterone, insulin, and catecholamines can influence these levels as well. On to calcium. This is necessary for the structure of bones and teeth and blood clotting, hormone secretion, and cell receptor function. Its normal ranges are 8.5 to 10.6. With hypercalcemia, you'll see a decreased neuromuscular excitability, muscle weakness, an increase in bone fractures, kidney stones, and constipation. This can be caused by an overactive parathyroid gland caused by a tumor, too much vitamin D, or cancer. I just wanted to say, with the increased bone fractures, in my mind, I would think if you had an increased calcium level, like, you should be okay with your bones and stuff. But actually, with increased blood serum of calcium, it's actually taking out the calcium from your bones and putting it into the bloodstream, which increases those bone fractures. It can also increases the block of sodium into the cell if you have too much calcium. Hypocalcemia can be caused by a lack of vitamin D, hypoparathyroidism, or some kidney disorders. It can cause increased neuromuscular excitability and muscle cramps. Phosphorus is always associated with calcium because they have like the inverse reaction when coming to their levels. But for right now, phosphorus is necessary for high energy bonds located in the creatinine phosphate and ATP, and it acts as an anion buffer. Its normal levels are 2.5 to 4.5. So, as I said, that phosphorus is the inverse of calcium. So when that happens, like if one increases, the other one will decrease. So if you see hyperphosphatemia, it would be the same signs and symptoms as hypocalcemia, but with disturbed energy metabolism, leukocyte, and platelet dysfunction. So with hypophosphatemia, it's the same as hypercalcemia, and it has more things that can cause it, such as acute or chronic renal failure, with significant loss of glomerular filtration, or long-term calcium or laxative use. Magnesium acts as a cofactor in protein and nucleic acid synthesis. It is required for ATPase activity. Its normal levels are 1.8 to 2.4, and it is an intracellular cation, and it decreases acetylcholine at the neuromuscular junction. With hypermagnesemia, it can be caused by renal failure, ingestion of antacids that contain that magnesium, or cathartics. It's associated with hypercalcemia and hyperkalemia. With increased magnesium levels, you'll see muscle weakness, hypotension, respiratory depression, lethargy, drowsiness, and bradycardia. And with hypomagnesemia, this is just like inadequate magnesium intake and absorption. You'll see neuromuscular irritability, tetany, convulsions, and hyperactive reflexes. Actually, an increased excretion of magnesium can be due to hypercalcemia.